Good afternoon. Today we will begin a series of conversations devoted to errors in the treatment of patients with malignant neoplasms. Errors in the treatment of a patient with carcinoma are one of the reasons for unsatisfactory treatment results. These errors exist in the planning of surgical treatment. And radiation therapy and chemotherapy and hormone therapy. In recent years, targeted therapy has become widespread. There are also many errors here. And all these errors lead to unsatisfactory treatment results. The most important thing is, the most important mistake that we most often encounter is when a doctor treats a non-sick person. Not a cancer patient, but when he treats a tumor without paying attention to the state of the person's body. This is due to the lack of understanding of doctors with their focus on the successes of modern chemotherapy, hormone therapy, targeted therapy. And when they see success in these industries, aimed at reducing tumor mass, the human body's capabilities are often ignored. That is, the strategic program is tumor suppression. And despite the fact that the human body is already in a damaged state, it practically does not withstand the therapy. Nevertheless, they try with the help of various factors, various medications that are aimed at therapy. Stimulating the activation of an already hyperactivated, hyperdestroyed human body, that is, figuratively speaking, the body is spurred on with the help of medications. A driven horse, I repeat, figuratively speaking. And this leads to the fact that the tumor, yes, the tumor really disappears. But after some time, the disease returns again. And this is due to the fact that it is ignored. A very serious process of interaction between tumors and the entire human body, which is associated with the tumor by numerous signaling pathways. This is not only the immune and endocrine systems. There are many factors here, which include the regulation of metabolism, and the function of the cardiovascular system, transport of carbohydrates, amino acids. That is, this is a very complex process of interaction between the tumor and the human body. And therefore, when planning treatment, when carrying out treatment, it is very important to pay attention not only to the reaction of the tumor, but also to the condition of the person receiving treatment. Why is it important to assess the condition of a sick person? This is due to the fact that a tumor is not a local process when a doctor plans to remove a tumor. A tumor is the tip of the iceberg. Unfortunately, a tumor is a systemic process. When, along with a tumor that a person has, there are tumor complexes in the patient's blood and lymph, and the fact that the tumor disappears, this is far from a fact that we have a good treatment result. The most difficult thing is behavior. Invisible behavior of circulating complexes in the patient's blood and lymph. I repeat, we are not talking about preservation of metastasis, for example, in a regional lymphatic condition. We are talking about the fact that tumor cells spread throughout the human body. For those interested in this issue, you can find a series of talks on my page dedicated to liquid biopsy. I touch on this topic in more detail, related to circulating complexes. And these complexes in a weakened person can very quickly lead to the development of a metastatic process, can lead to relapses of diseases. The next mistake is misunderstanding. Doctors of classification. Classification is a very important element in assessing the state of the tumor process. Here, first of all, I would like to draw attention to the classification of tumor tissue that is in the patient's blood. We will consider the errors associated with incorrect staging when I talk in more detail about errors in surgical treatment, radiation therapy, chemotherapy, hormone therapy, and errors in targeted therapy. Today, we will pay more attention to relationships, to errors associated with the relationship between the tumor and the human body, and in this relationship, the decisive role belongs to the tumor tissue that remains in the blood and lymph. And there is a classification of this tissue, which significantly affects treatment planning. And when the doctor does not know this classification, and all his actions are aimed only at tumor removal, when he achieves complete destruction of the tumor with the help of radiation therapy, chemotherapy, complex treatment, then various elements remain. These are not only tumor cells. There is tumor RNA, there is tumor DNA, various vesicles, fragments of cells that can subsequently cause relapses and metastases. Moreover, these complexes change dynamically over time. For example, excellent treatment was carried out, no tumor is observed. A blood test was carried out, there are no tumor complexes there either. But only after some time we get a relapse of the disease or metastasis develops. Because we need to talk about dynamic changes in tumor tissue in the human body. In addition to circulating complexes, there are also so-called tumor stem cells, which can manifest themselves at certain stages of human development. Here's why. The most important direction in treating a sick person is not only the use of a complex of modern technologies, but great importance should be given to the state of the human body, which is able to protect itself from tumor tissue. That is why after complex treatment, we have a return of the disease in remote periods, after 10, after 30 years. And in some cases, excellent treatment was carried out, and the disease returned quite early. This is due to the protective forces of the human body. They can. Yes, there is a large group of patients, this is about a third of patients with malignant tumors, who have preserved protective organs. Properties of the body that are able to prevent the remaining tumor cells from developing into metastasis or relapse. But we must say that over time there may be stress, there may be the effects of various biorhythms. All this may lead to a breakdown of the body's defenses, and as a result we have an unsatisfactory treatment result. You can see the percentage of these failures in the cancer registry. These are all the cases when excellent complex treatment was carried out, but the disease returned again. These are all cases when the human body is weakened. To one degree or another, or at different periods of time its defenses weaken, then it leads to the fact that tumor tissue in the human body gets out of control. That's why, when you are told that cancer is curable, or cancer is like the flu, it must be treated. This is all untrue. This is a very complex disease that every person proceeds very individually. That's why, even when following the protocol, a very fashionable word has appeared in oncology now, protocol. We do not always have good treatment results. Some of the errors are related to misunderstanding the presence of so-called cambial or stem cells. Extremely difficult to remove. I will tell you in more detail about the possibilities of radiation therapy, chemotherapy, targeted therapy. I will tell you in the relevant conversations devoted to these very important areas in the treatment of a patient with a malignant tumor. The purpose of today's conversation is to show you the general picture of errors in the treatment of a patient with malignant neoplasms. And in order to get a good treatment result, you need to achieve a good complex in the effect on tumor cells. Focus on reducing tumor mass is a strategic direction of modern oncology, but it is mandatory. The possibilities of tumor destruction should be commensurate with the state of the human body's protective resources. Thank you for your attention. In the following conversations, we will talk about the most frequently repeated mistakes. in surgical treatment of patients with malignant tumors. Now a lot of methods of surgical treatment are proposed. There are modern methods of treatment. Surgical treatment. Should we focus primarily on the latest achievements, or is it better to go the traditional way, which oncologists have been using for many decades and even centuries in treating patients with malignant tumors? This is the topic. We will talk about this problem in the next lecture, dedicated to mistakes. When planning surgical treatment of a patient with a low-quality tumor,